since the early 1990s, Uganda recognized the importance of the private sector in the delivery of health services. And in 1994, there was a recruitment of a public-private partnership in health desk officer in the Ministry of Health. And so he was tasked, and he was housed in the Department of Planning in the Ministry of Health, and he was tasked with coordinating the partnership between government and the private sector in health in terms of policy elaboration, planning, service delivery, monitoring and evaluation. And he was also tasked with the issues of thinking together with the private sector on how we can improve the collaboration in pursuit of a common goal, health services to the population. Now, as time went on, the private sector role in the outputs that were reported from the health sector kept on growing. So in the last 5 years, the private sector has consistently been producing 50 to 60% of the reported outputs in service delivery in the health sector. So government recognized its importance, and together with the private sector, government started working on a process of enacting a clear, explicit framework which will define the relationship between the public and private sectors in health. So early last year, the government enacted a public-private partnership in health policy, which defines how the government will be relating to the three categories of healthcare providers within the private sector. Now, after the enactment of this framework, government realized that there's a lot of work that needs to be done. There's a lot that can be done to improve our health system by collaborating with the private sector. So a public-private partnership in health desk officer was not enough. We needed extra hands. So a deliberate decision was taken to form a private partnership in health unit within the Ministry of Health. And we are now moving towards the process of making sure that it can be set up properly and funded with the extra hands to deal with different categories of private sector healthcare stakeholders. Basically, it is going to be playing a stewardship and coordinating role in the partnership between the public and private sectors. And it is going to be a one-stop center to make sure that we can be able to have the databases that are required to inform decision-making about where resources are invested within the health system, whether in the public or private sectors. And everybody who is working in the private sector in one way or another is interacting with government, and the private sector has been having a serious problem in its interaction with the government because of absence of a point of call where the issues to do with the private sector functionality can be handled. And we think that this unit will be useful. It will have somebody dealing with what has been called private not-for-profit healthcare institutions, then those private state and non-state actors, and then also the traditional and complementary medicine practitioners. And we are also going to make sure, we have always wanted as a sector to be able to attribute outputs to inputs and outputs to who produces them. And this is going to be a hub for analysis of this data to make sure that every time we are reporting about inputs and outputs in the health sector, we can be able to explicitly attribute who is producing. Is it public sector inputs? Are they private sector inputs? Are the outputs private sector outputs, or are they public sector outputs? And we think this will enable us to be able to clearly emphasize the growing role of the private sector in service delivery within our market. We think that is something that is important. Right now, government reports outputs, but it doesn't tell us whether it's the one producing them or it's the private sector producing them. Now, I think one of the key challenges is that these public-private partnerships are a new way of doing things. And in order for them to succeed, we will require strong government institutions. with the knowledge and structuring that is adequate to handle public-private partnerships. Right now, I see that as a challenge because we don't have a critical mass of people within the public sector who understand public-private partnerships, and that is a big problem. The second problem I see is the acceptance of the public-private partnership structure within the public services of countries, because government looks at this as an extension of expenditure on public service. Fortunately for the public and public-private partnership unit in the Ministry of Health, we will not have this problem, because when we wrote out the concept for how it will run, we elaborated a hybrid compensation model for this unit. Government will pay part of the staff of the unit, and the private sector is going to pay part of the staff of the unit. So even the compensation for the unit staff will be on a partnership basis, and we think that helps. The third one is the third challenge that I see is that there has been a lot of emphasis by the international community on public-private partnerships to be understood using an infrastructure paradigm. And we think that we need to rethink this, because public-private partnerships are not only in infrastructure, they are in a lot of other things. We've seen partnerships in legal and regulatory areas. We've seen partnerships in service delivery that is not infrastructure. So we should really refrain from saying that public-private partnerships are a financing mechanism. They are not. They are much more than that. I think the biggest success so far has been to have my government officially approve a framework for public-private partnerships in health. I think that has been wonderful, because it has given us a basis on which to operate. The second one has been the convincing my ministry that we need a public-private partnership unit and not just an individual to handle the private sector. I think that has been useful. I think the third one has been the growing appreciation among policymakers within our market about the importance of the private sector in health. And this has been manifested by the growing interest of government within the private sector. For example, government deliberately bought an equity stake in a pharmaceutical industry in Uganda in order to support them to grow. Government is increasing the amount of financial support it is giving the private sector. Government is seconding public sector workers to private institutions to work. And I think this is wonderful. We are now thinking about the health system as a whole, not just as a public system or a private system. And I think this is a major success for me.